Hi everybody. Bleeding disorder is very common in India, but it will be went through without any proper diagnosis or the treatment. Today let's talk to Dr. Neema Bhat to know more about the bleeding disorders. Can you briefly explain about bleeding disorder and how they affect the body?
There is a particular system in our body called coagulation system. What this means is whenever there is a small insult either on the surface of the skin or any part of our body, this whole system gets activated. So this system usually is comprised of, or it contains clotting proteins, which are proteins that are manufactured by the liver, platelets, which are parts of our the blood cells, which are small cells actually which come together the moment there is a cut or an injury or a bleeding point, and some calcium and some other few important proteins that are also produced by the liver as well as blood vessels. So this bleeding system or coagulation system, what we call it, it is very important. It's like a vital organ of its own in our body, which if it doesn't function, then we can bleed to death.
What are some of the common bleeding disorder and how they are different? Like hemophilia, Willebrand disease, platelet disorder.
So as I mentioned, the coagulation system is made up of these small little subsystems. So hemophilia is one of the most common disorders, bleeding disorders in the entire world. There are factors called factor 8 and factor 9. So there are totally 13 factors that we have, these clotting factors that help us control the bleeding. Specifically when there is a deficiency in this factor 8 and factor 9, it is called hemophilia. It's of two types, hemophilia A and B. In India, there is higher prevalence of hemophilia A, but there are also a few patients with hemophilia B. These hemophilias can be of varying varieties. The patient can have mild hemophilia A, can have moderate or severe. It all depends on how low the clotting factor is already present. Usually these hemophilias tend to be genetic disorders, which means there is a history of bleeding disorder in someone in the family, or if you have mother and father both are traits, or both of them have mild hemophilia A or B, then it is usually what we call autosomal recessive. So you get one defective gene of this factor 8 from the father and one defective gene from the mother, and that makes you have severe hemophilia A or with the bleeding disorder. Now, the other type that you asked about, von Willebrand disease, is much rarer compared to hemophilia, but it can also cause life-threatening bleeding. So this can be diagnosed actually only by a hematologist, somebody who has thorough knowledge about the bleeding system. Again, von Willebrand disease or von Willebrand disorder has various degrees. It can be mild, moderate or severe bleeding. There are actually different types. So it can be type 1, type 2, type 3, and that requires a lot of suspicion or a high degree of suspicion from the doctor to be able to diagnose. So von Willebrand type 1 is actually one of the most common bleeding disorders and tends to be very mild. These patients usually just have a little bit extra oozing when the tooth is extracted. They may have little extra bruising and they don't know how they got the bruise. So these are disorders that will take a little extra suspicion and also progressive testing. For a patient who comes with a suspicion for bleeding disorder, we can't really do all the tests at once because there are multiple parts in the coagulation system that can be involved. So usually the diagnosis is done in a very systematic way. So we first ask for blood tests and then follow it through with some more tests. The last thing that is part of the bleeding system is your platelets, which are blood cells. So if the platelets are either low in count, which we see in various conditions, anything involving the bone marrow or ITP or autoimmune disorders, that can cause low platelets, which can lead to bleeding. Also conditions where reduced platelet production or reduced platelet function. So there are conditions called Bernard-Solier, Glanzmann's thrombasthenia. These are all conditions where the platelet count is normal, but they don't function normally at all. So they don't come to the site where there is bleeding and try to stop it. So again, it's a system with a varied degree of presentation. So requires a highly skilled expert to be able to suspect for and diagnose the right type of bleeding disorder.
How the bleeding disorders are diagnosed?
As I said, you need to have a high degree of suspicion. If you feel you have a cut and you're bleeding for too long compared to people around you, say your friends or your colleagues, if you just get a random bruise on your thigh, on your abdomen, so these are all areas where we usually don't tend to hit ourselves. So forearms, arms, legs is usually areas where there is more trauma, as in you might hit yourself against a door or a cupboard or cot or something like that. So those areas to have a bruise here and there is very normal. But upper inner thighs, abdomen, the back, these are all areas that are less exposed to trauma. So if you keep on getting recurrent bruising in these places, then you need to come out and see a specialist who can diagnose you. Other than that, if you have undergone a surgery and your doctor has told you you had severe bleeding, it was very difficult for us to stop the bleeding after the surgery, we had to give you blood products to try to stop the bleeding, that is a red flag, and that requires to be mentioned to your hematologist so that we can evaluate and diagnose the bleeding disorder. One other small thing that also gets missed quite often is tooth extraction. So although we know tooth extraction is a simple procedure, sometimes in patients with bleeding disorders, even a small procedure like a tooth extraction can cause severe bleeding. May not be life threatening, but the bleeding or oozing can go on for a long period of time. So whenever there is such an event where tooth extraction is done and there is a long prolonged period of bleeding, usually after a tooth extraction there should be bleeding for maybe 1 or 2 days maximum, after which it should stop. But if the bleeding continues, if the oozing continues, that means you have to be worked up, you have to be seen by a specialist and diagnosed if you have a bleeding disorder.